Hi, my name is Dr. Banning, and I'm the medical director here at the Animal Rescue League. My day is typically split between surgeries in the mornings and veterinary exams in the afternoon. Before we start with our surgeries, we do a pre-surgery exam on all of our patients for that day to make sure that they are healthy enough for our surgeries. During our physical exam, we are mostly looking to make sure that the heart and lungs are healthy enough to undergo anesthesia. Because we perform so many surgeries each day, it is particularly important that we are as confident as possible in the health of our patients. If any abnormalities are seen on this exam, a veterinary exam will be scheduled later in the afternoon to look into the issues that we found. We're all finished with surgery today. We've finished with 41 total surgeries, including 1 eye enucleation and 1 dental cleaning. 41's a little on the high end. We normally average between 30 and 40 surgeries per day, and that usually brings us to around 1 o'clock in the afternoon. So let's head over to the shelter and we'll start working on some veterinary exams. Our first patient here is a kitten named Hedgehog. Hedgehog has very suspicious looking skin lesions. These spots are very well delineated with hair loss, but generally no redness of the skin, and they are not itchy. In addition to that, if we were to shine a black light on these spots, they would fluoresce a yellow-green color. Based on these clinical signs and the fact that this kitten was roaming outside prior to coming to our shelter, we are very suspicious of a disease called ringworm disease. Ringworm disease is a fungal infection, and it is particularly concerning because it is very contagious and can spread between animals and humans, what we would call a zoonotic disease. So it's very important that we catch these signs very quickly and isolate them until they are finished with their treatment. Fortunately, treatment is straightforward, although it is very time-consuming. It consists of a topical and oral antifungal, and generally treatment takes between 4 and 6 weeks from the time of diagnosis to the time of treatment. So unfortunately, these guys are in isolation for quite a long time. We'll get Hedgehog here started on treatment very quickly, and hopefully we'll be out of here in no time. For our next exam, we have Otis. Otis is a little puppy that came in with his mom and sibling. We noticed an issue with his walking. His hind legs did not seem to walk appropriately, so we've done a physical exam and we found that our kneecaps are slightly out of place. They are displaced to the inside of both of his legs. With that diagnosis, we reached out to our orthopedic surgeon consult, who recommended that we do 2 months of physical therapy while we wait for him to develop a little bit more, at which time he'll require surgery to have those kneecaps replaced. In this field, every day brings unique challenges. Some afternoons are filled with more exams. However, there are still days that surprise us. A few months ago, our animal protection department called us to let us know that they were at a property where 36 dogs were about to be surrendered into our care. We knew that this large number would require all hands on deck, as we had to evaluate each dog. We didn't know the conditions of the dogs, so we weren't sure what to expect. We split into 2 teams to speed up the process, and with help from our animal care and pet help center departments, we were able to examine, vaccinate, microchip, and deworm all 36 dogs that afternoon. Number 33 is 6.1 pounds. Among these dogs, there was a mother and newborn puppies who were sent to foster that night. We suspected another dog was pregnant, and radiographs showed 4 puppies soon to be born. She was sent to foster as well to give birth in a calm home environment. Several others were severely matted, and many of the older dogs had severe dental disease, and we were able to perform dental cleanings while extracting severely damaged teeth at the time of their spay or neuter. The remaining dogs were spayed or neutered over the next few days and placed up for adoption. Before heading home, I finished writing notes into any medical records and reviewing tomorrow's surgery and exam list to see what the next day has in store. That wraps up a day in my life. Thank you all for watching.